Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study concerning eunatremic, eukalemic hypoadrenocorticism, EACTH, in dogs, a condition that presents diagnostic challenges and has implications for our understanding of canine health. Our journey begins with an appreciation of the complexities inherent in diagnosing hypoadrenocorticism, HA, a relatively rare endocrinopathy in dogs. The predominant form, primary HA, arises from the bilateral destruction of the adrenal glands, accounting for over 95% of cases. A less common condition, secondary HA, stems from diminished adrenocorticotropic hormone, ACTH, secretion by the pituitary gland. In many instances of primary HA, both glucocorticoid and mineralocorticoid secretions are compromised, leading to hypocortisolemia and electrolyte imbalances. However, a subset of dogs, up to 30%, maintain normal electrolyte concentrations at the time of diagnosis. This is the condition defined as eunatremic, eukalemic hypoadrenocorticism, EACTH, otherwise known as atypical HA. In dogs with EACTH, there is permanent hypocortisolemia and low or undetectable aldosterone despite normal electrolyte levels. The insidious nature of EACTH lies in its vague clinical signs and the absence of typical biochemical abnormalities, often leading to misdiagnosis as other conditions such as chronic gastrointestinal disease, CGD. The diagnosis of HA hinges on adrenal gland function testing, with the ACTH stimulation test, ACTHst, considered the gold standard. However, challenges exist, including the ACTH's high cost and the inconsistent availability of exogenous ACTH. Basal serum cortisol, BSC, concentration, with a cutoff value of less than 2 μg/dl, is often used as a screening tool to rule out HA. Though BSE concentration demonstrates excellent sensitivity for HA, its low specificity means that many dogs with CGD, but without HA, also exhibit low BSC. This has prompted investigations into alternative screening tests, such as urine cortisol-to-creatinine ratio, UCCR, and cortisol-to-ACTH ratio, CAR. Moreover, previous glucocorticoid administration, PGA, a common practice in dogs with CGD signs, can yield false positive results on the ACTHst. Prior studies often relied on the dog's history to exclude PGA, which may have led to an overdiagnosis of EACTH. Measuring endogenous ACTH concentration, eACTH, could provide a means of differentiating EACTH from false positive ACTHst results due to PGA. In secondary HA, eACTH levels are low. Therefore, a definitive EACTH diagnosis requires consideration of the dog's history and ACTHst results, along with confirmation of elevated eACTH. To address these diagnostic dilemmas, a study was undertaken to determine the prevalence of EACTH in dogs showing CGD signs, to identify clinical and clinicopathological features that distinguish atypical HA from CGD, and to recognize PGA in dogs with CGD. The study, a multi-center prospective cohort design, enrolled dogs with chronic signs greater than 3 weeks consistent with HA, such as vomiting, diarrhea, decreased appetite, weakness, or lethargy. These signs must be routinely seen in dogs with HA. The presence of either vomiting or diarrhea was mandatory. Conducted at veterinary hospitals of the universities of Bologna and Lisbon between June 2019 and December 2021. The study also reviewed medical records of dogs diagnosed with EACTH at the Veterinary Teaching Hospital of the University of Bologna between January 2009 and December 2021. Data collected at enrollment included signalment, history, including prior glucocorticoid administration, physical examination findings, and laboratory results, encompassing complete blood count, serum chemistry profile, and urinalysis. Diagnostic procedures included BSE measurement and folate and cobalamin concentration determination. ACTHst and eACTH measurements were performed when BSC was less than 2 μg/dl and in dogs with PGA. Fecal testing was also performed. Dogs were categorized into non-PGA, no glucocorticoids in the previous 90 days, and PGA, received systemic or topical glucocorticoids discontinued less than 90 days before admission groups. In PGA dogs, ACTHst and eACTH measurements were repeated if post-ACTH serum cortisol concentration was less than 3 μg/dl. EACTH diagnosis required the following criteria: post-ACTH serum cortisol concentration less than 2.0 μg/dl, higher undetectable plasma eACTH concentrations, and absence of electrolyte abnormalities. Dogs with undetectable eACTH were excluded from the EH group if they had received glucocorticoids within 90 days before testing. For the ACTHst, blood samples were collected before and 60 minutes after intravenous injection of synthetic ACTH. Blood samples for eACTH determination were taken before synthetic ACTH injection. BSC and eACTH concentrations were used to calculate the CAR. Analytical procedures were performed at the veterinary laboratory of the University of Bologna, with samples from Lisbon stored at -80 degrees Celsius and shipped overnight on dry ice. Serum cortisol and eACTH concentrations were measured using a chemiluminescent enzyme immunoassay. Statistical analyses were conducted using commercial software. Descriptive statistics characterized the study population. Continuous variables were presented as median and range, while categorical variables were described with frequencies, proportions, or percentages. The overall EH prevalence and 95% confidence interval, CI, were calculated. Differences between non-PGA, PGA, and EH groups were analyzed using Fisher's ACTHst and Kruskal-Wallis test with Dunn's post-test. The study enrolled 112 dogs, 101 non-PGA, and 11 PGA. EH was diagnosed in 1 dog, giving a prevalence estimate of 0.9%. The study population consisted of 69 male dogs, 41 neutered, and 43 female dogs, 22 spayed. The median age and body weight were 3.0 years and 21.9 kilograms, respectively. Mixed breeds were the most common. Polyuria and polydipsia were more frequently reported in PGA dogs compared to non-PGA dogs. Prednisolone was the most common medication used in PGA dogs. The median dose was 0.5 milligrams per kilogram. The median duration of glucocorticoid treatment and discontinuation was 60 and 25 days, respectively. EH was diagnosed in a 7-year-old spayed miniature pinscher with a 6-month history of weight loss, vomiting, diarrhea, hematemesis, and hematochezia. Retrospective data from 19 additional dogs with EH were collected. The median age and body weight of these dogs were 5.4 years and 19 kilograms, respectively. Decreased appetite and weakness or lethargy were more common in EH dogs compared to non-PGA dogs, whereas polyuria and polydipsia were more common in PGA dogs compared to EH dogs. Based on eACTH concentration, primary and secondary EH were diagnosed in 69% and 31% of dogs, respectively. Concurrent diseases were documented in 63% of dogs, with primary inflammatory enteropathy being the most common comorbidity. None of the dogs developed electrolyte abnormalities after diagnosis. Dogs with EH showed significantly lower hematocrit, serum albumin concentration, and albumin to globulin ratio, and higher red cell distribution with compared to non-PGA dogs. Moreover, EH dogs had lower serum albumin and higher potassium concentrations compared to PGA dogs. Haptoglobin concentration was significantly higher, and the C-reactive protein to haptoglobin ratio was significantly lower in PGA dogs than in non-PGA dogs. In non-PGA dogs, 47.5% had basal serum cortisol less than 2 μg/dl. Basal serum cortisol was less than 2 μg/dl in all PGA dogs. The ACTH stimulation test provided a false positive result in 2 of 11 PGA dogs. Dogs with EH showed lower basal serum cortisol and post-ACTH cortisol and higher endogenous ACTH than non-PGA dogs. Moreover, the cortisol-to-ACTH ratio was significantly lower in EH dogs compared to non-PGA and PGA dogs. The discussion of this study emphasizes that the prevalence of eunatremic, eukalemic hypoadrenocorticism in dogs with chronic gastrointestinal disease was lower than previously reported. The prevalence closely matched the overall hypoadrenocorticism prevalence in the general canine population. The current study's findings contrast with prior studies that reported higher EH prevalence in dogs with chronic gastrointestinal disease signs. The differences could be due to not measuring endogenous ACTH concentration in the previous studies, which might have led to an overestimation of the true prevalence of eunatremic, eukalemic hypoadrenocorticism. Furthermore, differing inclusion criteria, especially relating to previous glucocorticoid administration, could explain the differences between studies. The ACTH stimulation test gave a false positive result in 2 dogs with previous glucocorticoid administration. It is important to exclude previous glucocorticoid administration in dogs with low pre- and post-ACTH cortisol concentrations. Glucocorticoids suppress the hypothalamic pituitary adrenal axis, with the duration of suppression varying based on the preparation, dose, and individual sensitivity. Endogenous ACTH measurement is of utmost importance as it allows the clinician to suspect iatrogenic hypoadrenocorticism. This study identified clinical and laboratory variables that differed significantly between the previous glucocorticoid administration dogs and the other study groups. Polyuria and polydipsia were more commonly reported in the previous glucocorticoid administration dogs when compared with the eunatremic, eukalemic hypoadrenocorticism and the non-previous glucocorticoid administration dogs. Serum albumin and potassium concentrations were significantly different between the previous glucocorticoid administration and the eunatremic, eukalemic hypoadrenocorticism dogs. However, substantial overlap was observed. Serum haptoglobin concentration was significantly higher and the C-reactive protein-to-haptoglobin ratio significantly lower in the previous glucocorticoid administration than in the non-previous glucocorticoid administration dogs. Measurement of the C-reactive protein-to-haptoglobin ratio could be useful for differentiating previous glucocorticoid administration from non-previous glucocorticoid administration dogs, since exogenous glucocorticoid treatment appears to blunt the magnitude of C-reactive protein elevation in dogs with an inflammatory state. In the current study, 47.5% of the non-previous glucocorticoid administration and all the previous glucocorticoid administration dogs had a basal serum cortisol concentration less than 2 μg/dl. Determination of the basal serum cortisol concentration has a high sensitivity for hypoadrenocorticism but a low specificity. Therefore, because of the low specificity of the test, an ACTH stimulation test should be carried out in dogs with basal serum cortisol less than 2 μg/dl in order to exclude hypoadrenocorticism. The cortisol-to-ACTH ratio is a valuable and reliable tool for diagnosing primary hypoadrenocorticism. Based on endogenous ACTH concentration, primary and secondary eunatremic, eukalemic hypoadrenocorticism was diagnosed in 69% and 31% of dogs, respectively. Dogs with eunatremic, eukalemic hypoadrenocorticism were more likely to have decreased appetite, weakness, or lethargy when compared with non-previous glucocorticoid administration dogs. Concurrent diseases were documented in 63% of the dogs, and the majority of the comorbidities were immune disorders. A small percentage of dogs with eunatremic, eukalemic hypoadrenocorticism can develop abnormalities in serum electrolyte concentrations indicative of mineralocorticoid deficiency weeks to months after diagnosis. Clinicopathologic features, including hematocrit, red cell distribution width, serum albumin, and an albumin/globulin ratio, were significantly different between the eunatremic, eukalemic hypoadrenocorticism and the non-previous glucocorticoid administration dogs. The study had some limitations, including the small sample size in the eunatremic, eukalemic hypoadrenocorticism and the previous glucocorticoid administration groups, which could have influenced the statistical power. In conclusion, the prevalence of eunatremic, eukalemic hypoadrenocorticism in dogs with signs of chronic gastrointestinal disease was lower than previously reported. Glucocorticoid administration, even for a few days, could cause false positive results on the ACTH stimulation test. It is important to measure endogenous ACTH and to repeat the ACTH stimulation test when previous glucocorticoid administration is suspected. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.